name is Nancy DiSalvo, and I live in Palermo, Sicily. I am a CIDP patient. I was diagnosed with CIDP in 2006, and it was quite a long journey towards diagnosis due to the condition that was not very visible. And at first it was just mentioned as being clumsy while I was falling, and I broke once my left foot, then my right foot, until I finally came to a physician who underwent certain exams and clarified my clinical condition. At that point, I was a patient who was looking for therapy, who underwent corticosteroids at first, but that were not giving me the condition and the quality of life that I really was pursuing. I then came to know that I could undergo sub-Q immunoglobulin, and from that point on, I slowly recovered from my condition that brought me from the wheelchair to being able to walk unaided and to being able to climb steps, and also to be an advocate for the condition. At this point, I am a member of the GBS CIDP Foundation International and the European organization. We advocate for the patients with GBS, CIDP, and MMN, and all other variants that are included in this condition. My advocacy starts from my hometown, where I try to help patients that are freshly diagnosed and need to be directed to the right physician, to the right physical therapy centers. Well, I was diagnosed after a year or so, because in the beginning they were saying that I had a condition that was related to me getting old, and I was only 36. So that kind of triggered a lot of questions. And then when I started to fall down, and like I said, I had various fractures on my limbs, I decided to see a neurologist. The neurologist then gave me an EMG exam, an electrical myography, that could measure the distance it took from the signal that the brain sent to the nervous system and how long it took to reach the foot or the arm. And there were several interruptions in that case. Then we underwent some biopsies of the sural nerve and an MRI scan and many other clinical tests and blood work. But the diagnosis after that point, after all this clinical treatment, was actually pretty fast. CIDP was immediately the diagnosis they gave me. Well, before diagnosis, I was having difficulty when I was walking and when I was climbing the stairs, and I had an extreme fatigue just waking up in the morning. I could barely run through my day at work, and there I had to call off lots of time for condition of illness, and very much I felt weak. After the diagnosis, in the beginning, I started to feel the strength when I underwent corticosteroids, but it was not giving me that boost, and it was not healing the myelin that was at that point very well damaged, severely damaged, because it took a while for me to understand that I was going through a neurological condition. When I started corticosteroids, I felt the boost, but I still had difficulties, and I needed assistance with a wheelchair or with a cane because I lost stability, especially with it being a motor skill condition. When I was then moved on to immunoglobulins, I slowly felt that I was recovering, because in addition to the immunoglobulin, I added physical therapy, and I was rebuilding my muscle strength while my nerve was healing from the myelin that had been damaged. Well, I would say to never fear the condition, because it could be a condition that can severely damage you and give you a disability that you might think that you can never make it and that maybe your life is not worthy of, but it is, especially when you start to learn from other patients the conditions that they suffer and the quality of life that can also get better in time. You also have to persevere and never rely on others to help you, but rely on yourself, because the strength comes within, and with the help of the clinical community and our community of GBS and CIDP patients, we support one another and make sure that we go towards a better quality of life.